Hello everyone, my name's Abby. I'm a first year student nurse doing paediatric nursing at University of Northampton. My hometown, for anyone that might know, is Burton. It's near Derby, so it's in Derbyshire. Yeah, so I'm doing children and young people's nursing. But it's quite a good question actually. I chose my course because I have been in and out of hospital as I was younger, had some quite major operations. And the way that I connected with the nurses and when I was in hospital just made me want to be like them, give the care that they gave to me, and just make people feel better. I know I'm definitely in the right course, but it's much harder than I imagined it to be. You don't realise when you pick your course, you think this is going to be great. It's something I want to do, so I'm going to work hard, I'm interested in it, and I'm going to enjoy it. Whereas when you're at school, you're made to do subjects that you don't necessarily like, so you tend to slack in them. Whereas when you go to uni, you obviously get to choose. It's harder to get motivated, I think, even if you do enjoy it. So sometimes you've got that assignment, and even though you want to do it, you want to get it completed, it's still hard work, it still needs motivation, and you still get them moments that are like, have I really got to do this? But honestly, you just get a kickstart and you will get there. I came from a sixth form background. I did BTEC Level 3 Health and Social Care, BTEC Level 3 Media Studies and A-Level Psychology, the Health and Social Care and Psychology. The university I'm at is University of Northampton. I don't even know, the worst. Obviously everything has its faults, not everything is perfect. I feel with my university there's a bit of a lack of support. There is obviously support that you can go and receive yourself, but you have to seek that support, and not everyone wants to go out and get that support. They want it to be offered to them if they're in a time of need or stressing or anything like that. Like I say, there is meetings you can book with the support team and things like that, but you have to go and do that yourself. There isn't much around because it isn't like a city, it's more of a town. There is more things further afield, but that obviously requires a lot of travelling. But that's kind of the reason why I went there. I'm not big on changing places or meeting new people. So the reason I chose a smaller uni is because it was small. It didn't have much around. It reminded me of where I live, which made me feel more comfortable. I lived in student halls on the campus. Well, it's a bit hit and miss. It's good because you meet new friends. So in mine, there was 10 including me. So we had
10 students?
10 students, yeah.
In one house?
In one, yeah.
That's fine, carry on, sorry.
So that was a flat, so we all had our own room. In mine, we all had our own bathroom because we paid extra to have our own bathroom. So I didn't get any negative experience with that. But sharing a kitchen and getting used to how other people live is very hard. I've come from a background where I'm always taught to tidy up after myself. Whatever I get out, I put away. I leave things as I found them, whereas other people aren't necessarily like that. And I did notice that a lot when I moved into the halls. I would say the on-campus accommodation, purely because if you've got a 9 a.m, you can just roll out of bed and you're there in 2 minutes. I haven't got the experience from being obviously off campus, but I can imagine it is a bit of a pain. If you have got a 9 a.m, you have to get up at 7 to get in for 7:30 or whatever. So yeah. There are a couple of clubs which the uni are sponsored by that have all their main freshers events there. So they only have all their freshers events at one club. I only ended up going to 2. There is a few more, but they're a little bit further afield. So the main ones in the town centre are the 2 ones that are sponsored by the uni. But for me, that was enough because I'm not much of a party person.
When you say far, do you mean 10 minutes, 20 minutes, an hour?
Not necessarily too far. The main ones were a 10-minute walk, if that. And then probably a couple of streets away. So 15-20 minute walk were the other ones. Yeah, it is pretty basic. It's just imagine your typical town centre. It's nothing like Manchester, Birmingham, anything like that. It's got your McDonald's right next to the clubs. It's got Nando's, it's got KFC. And then if you do drive further out, a 10-minute drive, there is a residential park where there's more restaurants TGI Fridays, Bella Italia, things like that. But in terms of shops, there's more or less your standard ones you get in a normal small shopping centre. It's not a city. Don't expect to go there and expect like big city vibes, because it's really not. It is a small town, and you wouldn't necessarily expect a uni to be there, because like I say, there isn't much about. But if you are a quiet person and like a quiet area, then that's probably best. In general, just go in with an open mind. You aren't going to go in knowing everything, no matter if you've done something similar before. So for example, with my course, there are a lot of healthcare assistants on there that are studying to be nurses, whereas I have come from a background of like no clinical experience. So they come and bring lots of knowledge, but then that does make you feel like you don't know much. But honestly, you get taught the basics from the start anyway. Everyone gets taught the same and they go in at the same level, so don't expect to know everything as soon as you begin. And like I say, just go in with an open mind. The uni is like pretty new, so it is a nice campus. It's only been there I think 3 years or so. It's really easy to locate as well. Like there's not much like area of the campus. There's a few, like 3 buildings I think, which are mainly where they teach. But yeah, so pretty much just expect what I've said really. Don't expect a city or anything like that, because it is quiet. My course, like I said, it is difficult. I thought I was going to go in there and be able to achieve things straight away, know everything straight away and understand everything straight away, but that's not the case. You will need the support, and you will need to ask for support, and you need to lean on your friends and your course mates for that too, because I can guarantee the question that you're thinking, they're probably thinking the same thing. So as long as you just speak up if you can, or ask for support, or lean on your friends. It's the nature of what I wanted to do. I know they have adapted things and started offering nursing apprenticeships, so obviously you work alongside doing your course and learning things as well. I just obviously wasn't very familiar with that. It's not been around very long, whereas normally if you go to uni, you will do the course and you'll do placement and things like that, and people normally expect if you're going to be a nurse, you will have gone and done some sort of like degree at a university. I feel like doing an apprenticeship in nursing is pretty similar, because you will work like we do placements at uni, but obviously you will get paid for them. So I'm not sure really which is the best to go for. So my Instagram is just a little student nurse page that I think I started it in May, so not that long ago, and just building up. And I just give advice to people that want to join my course, that are on my course, looking for support. I do slip a few things about my uni in particular, so like similar modules that I do, but obviously don't reveal anything too much. And then I just like post about student life, nursing life, any recommendations in terms of textbooks, pretty much things like that. So I'll go with how I got into nursing. So it's not like a sob story or anything, but I was poorly as a child. I was in and out of hospital. I have had multiple operations. And that's really like how I wanted to become a nurse. There is a post on my Instagram all about that, explaining it in further detail, but I'll just give you a bit of a brief summary. So I have something called Tetralogy of Fallot, which is a heart defect. So like I said, I've had multiple operations in the past, and I will need more as I get older, but that's not the reason. The reason is because the care that the nurses provide is honestly amazing. You go in there, you just expect to be cared for, and you just expect to move on. They can move on to the next patient. But honestly, the individualised care they give is outstanding. They tailor your needs to everything that they do. They make sure you're comfortable. They make sure that you don't feel like you're in hospital, and you just get the best experience you can out of it, really.